My name is Lindsey Ford, and I'm here today to educate the employees of the marketing department at St. Bernard's the most effective way to alert the media if there is an Ebola crisis. So, a crisis is taking place, and St. Bernard's has confirmed an Ebola virus diagnosis. So, the first thing that's going to happen is the patient will be isolated according to hospital protocols. The second step is to transport the patient to a designated Ebola treatment center. After the hospital has performed these vital roles, it is finally time to inform the media. While taking on this crisis, it is important that each employee works quickly and efficiently to relay the word to the media outlets. We will need all hands on deck here. When communicating to the public about a crisis, social media should be at the forefront of your mind. It's the information source that people check all day, every day, and will likely be how they find out about an emergency. A designated staff member or members need to be updating all social media outlets. Communicate with honesty about the Ebola diagnosis while acknowledging the risk. In the statement, you should inform the media that the hospital has confirmed the Ebola virus diagnosis and when it happened. Next, ensure that the patient was isolated according to protocols and transported to an Ebola treatment center. Give them a time frame of when this all took place, such as the patient in question presented about 8 a.m. with symptoms that are among those typical of Ebola virus, and the patient was evaluated and transported to a Little Rock hospital within a matter of approximately 2 hours. Remember to educate the public that St. Bernard's is trained for this specific situation and reassure them that the center is prepared for this Ebola crisis. Also, explain what Ebola treatment centers are and briefly explain how they operate. A St. Bernard's employee should also have a statement prepared. The following statement is a good example of something that might be used. As a part of our commitment to meet the healthcare needs of individuals throughout Northeast Arkansas and Southeast Missouri, St. Bernard's has devoted resources and training to ensure that we safely can evaluate a patient who is under investigation for Ebola, and that we can safely care for that patient in a manner that ensures his or her safety as well as that of our care team, our other patients, and our employees. The safety of our patients, all of our patients, and employees is always a top priority. We are fully prepared to fulfill a necessary role in isolating patients with emergent illnesses such as Ebola and in transporting those patients to designated Ebola treatment centers where care can be provided for the duration of a patient's illness. That is exactly what has happened today at St. Bernard's. We received a suspected Ebola patient, followed protocols to confirm a diagnosis, and transferred that patient to a facility for continuing care. And we did it in a manner that protected all of our other patients as well as our employees. For crisis communication success, remember to follow these tips if there is a case of Ebola diagnosed at St. Bernard's. It is also important to have regular drills to practice your skills and make sure that you are fully prepared for the times of crisis that could strike within this medical facility. Thank you.